Hi everyone, I am Dr. Karishmakagodu, board certified plastic surgeon practicing in Bangalore. Today I am going to take you through a walkthrough of an open tip rhinoplasty procedure for a client who was 35 years old and her main concerns were the tip of the nose. Her tip of the nose was extremely broad. She felt it was too boxy, it was downturned and she wanted to lift the tip of her nose. So I'm going to show you how an open tip rhinoplasty is done today and also show you the steps of the procedure. So a patient came in on the day of the procedure around 7:30 in the morning and we took her pre-procedure photographs, and when we do a rhinoplasty we always take the patient photographs in the frontal view, in the side views as well in oblique views, and along with the basal view. We make sure that she is medically fit before she goes into the operating theatre. We then escort her into the operating theatre where we will be putting her under general anesthesia. The procedure starts with making a sterile operating space. We paint the face with a BETADINE solution so that the operating area is extremely sterile. So as you can see, I have started the procedure by making an incision between the nostrils. This incision is an inverted V-tip incision. It is extended sideways and goes into the nostril rims. Once we have made this incision, we open up the nasal skin envelope and we raise the nasal skin in order to expose the areas of concern. The nasal lower lateral cartilages, as we call it, are extremely broad in this particular patient, and while we measure it very precisely, we see that it's about 10 to 11 millimeters. Now usually in females, this lower cartilages at the nasal tip are about 6 to 7 millimeters. So we are going to trim these cartilages and make it precisely about 6 millimeters in order to also preserve enough amount of cartilage to give us strength of the nose tip at a later date. So for a nose tip plasty, the most important step is here, where we are going to bring the cartilages closer to each other and try to create a triangular tripod. These cartilages are stitched in the midline between the nostrils and also at the tip, so that once they are stitched and brought closer to each other, the nose tip will look more slimmer, will look more sharper. And once the nasal skin redrapes over these cartilages, the external appearance will also have to be more slimmer, more refined. Now you can see that we have completed the tip rhinoplasty. We have brought the cartilages together, we have draped the skin envelope onto her nose, and we are going to finish it with the final sutures placed between the nostrils and close the wound. So the stitches that we have placed whilst closing the nose are extremely fine stitches which probably fall off by themselves in about 1 week to 10 days. We are going to put a nose plaster and nose tapes over the nose, and the initial healing phase is about 6 to 7 days. We are going to open her nose plaster after 6 days. During that time, we will give you few decongestant nasal sprays, and this will help to relieve the congestion in the nose. The patient has to just put a little bit of an antibiotic ointment at the stitch area. Once we remove the nose plaster, we also tell them that they would expect a little bit of swelling on the upper part of the face and around the eyes, but by the second or third week, usually the swelling and bruising subsides by itself. The patient would have to put a little bit of antibiotic ointment near the stitches for about 2 weeks till it heals. So this is the initial healing phase, and to perform this tip rhinoplasty, this entire procedure took only about 45 minutes to 1 hour. The patient was awake and alert within 5 to 10 minutes after the anesthesia, and she walked home the very same day. So I have made an entire video about the recovery of rhinoplasty, and the link to the video is given in the description below. Kindly click on the link and watch the video. It will answer most of your doubts about the recovery of rhinoplasty. To watch more videos about rhinoplasty, do subscribe to our channel Dr. Karishma Aesthetics. You can follow us on Instagram. Our handle is drkarishmaaesthetics, and thank you for watching. Don't forget to press the bell icon and keep your comments, and we would like to answer your comments. Please like our videos. Watch out for more videos in the future.